The honest truth is that social media works differently for a specialist than it does for a GP. A GP can post a photo of a teeth whitening result or a kid's first visit, and it will generate direct patient inquiries and engagement from followers. That's a real measurable acquisition channel for a GP. For a specialist, social media does something different. And understanding what it actually does is what determines whether it's worth your time. The first thing that it does is feed the AI search engines. Now, this surprises a lot of specialists. When a patient goes to ChatGPT or Google Gemini or Perplexity or Claude or any of these and does research on your practice, the AI is not just looking at your website. It's looking at your social media presence. How consistent are you? How often do you post, right? What do you post about? What kind of content is being published? Are you active? Are people responding to your comments or to your posts? Are they saying things about you? That social presence is one of the signals that AI uses to decide how confident it should be when recommending you or not recommending you. A practice with no social presence gets a thinner, less confident AI recommendation than a practice that shows up consistently across all channels. The second thing that social media does for a specialist is reinforce referral relationships. When you, as a specialist, post content on social media, you should acknowledge your referring practices, especially if it's about a patient who was referred. You can tag your GP in your posts. Why not? That keeps you visible in your GP's feed. It reminds them that sending you a patient reflects well on their practice. The third is credibility. When a referred patient looks you up, your social media is part of what they see. A practice with an active, human, well-run social presence looks more trustworthy than a practice with nothing there. It is not the primary reason someone calls you, but it contributes to the overall picture of who you are. So does social media matter for a specialist? Undeniably, yes, but for different reasons than it matters for a general dentist. And understanding the difference is what makes it useful rather than just busy work.